This is Selma Schimmel at the Multidisciplinary Cancer Congress 2011 in Stockholm. Professor Dr. Michael Baumann, you wear many hats at this meeting, and I'm very pleased that you made some time to talk to us. You're the president of ECCO, you're the president of this Multidisciplinary Congress. Explain the reason that this is a multidisciplinary meeting. It is a very distinguishing factor for what happens here.
Right. So what we see in clinical practice today is that we treat cancer patients in teams of specialists coming from different disciplines. For example, surgeons meet radiation oncologists, internal medicine people, medical oncologists, diagnostic radiologists, pathologists, and they all form a team reviewing the disease of the patient and then deciding together in tumor boards what the best treatment is for an individual patient. And this is multidisciplinary cancer treatment, care today, and that has been proven to be of great advantage for cancer patients. So we have much better results in terms of killing the cancer, but also in terms of preventing toxicity and having high quality of life. And this multidisciplinary cancer conference does exactly the same what is taking place in clinical practice. It brings together these different specialists to talk on the different tumor sites and also on different methodologies together. And there are presentations from different disciplines in the same sessions. So we communicate our data, our strengths, also our weaknesses, which we have in covering specific disease, and we identify together what is the way to go in research so that we can help future cancer patients more effectively.
ECCO as an organization, the focus of its work is what exactly?
ECCO is the European Cancer Organization. It's a federation and it brings together all the different societies which are involved in cancer treatment, in cancer research, in cancer care. It also brings together patient advocacy groups together with professionals in the field. So we are a federation, an umbrella organization, and our aim is to promote this thought of multidisciplinarity. That is our main effort to do that, and that is to provide each cancer patient the best we can offer today and future cancer patients better treatment than today.
And the relationship between ECCO and ESMO, as an example, we just had the ESMO meeting last year about the same time. How do, well, and there's 3 organizations involved here, but how do the 3 organizations interface together to create this meeting?
Right. So the 3 organizations which carry this meeting are ECCO, are ESMO, the Medical Oncology Society, and ASTRO, the Radiation Oncology Society. But it's all, and they both are members of ECCO. So ESMO and ASTRO both are members of ECCO. There are many other member societies, there are 24 at the time being, and they all work together to create this program. So it was a big scientific committee of experts from the different fields, and they reviewed what's new, and then they brought together the tracks and the sessions. So we have a total of 33 different tracks in this meeting, and they were all created based on this multidisciplinary model.
And while this is a European meeting, it certainly has an international flavor in the sense that there's quite a few Americans at this meeting as well.
Americans, Asians, so it's indeed an international meeting with a focus, of course, on Europe, but as usual, and rightly so, these meetings attract people from all over the world. It's the same for American meetings, which also are attended by quite a number of Europeans.
I'm curious, Professor Baumann, the differences you think philosophically maybe in the way in the U.S. maybe approaches cancer on many levels versus perhaps the European approach. Are there in your mind any differences, philosophic or any other way?
Well, for setting together this meeting, for example, I think the philosophy indeed is different. The philosophy here is that the different societies which represent the different specialties come together and create a program. Like we do it in a hospital, where also the different societies sit on the same tumor board. So that's our model here, and we think that's a great model. That is a bit different in the United States. Otherwise, I think that approaching cancer patients, how cancer care is organized, what we do today, what is standard of care, and also what do we do in research is very similar in the United States compared to Europe. But in Europe, we have a higher degree of heterogeneity between different countries. And that's also one topic we tackle at this conference. We have a so-called Oncopolicy Forum in this conference. And the Oncopolicy Forum brings together health professionals, brings together patients, but brings also together policymakers. Because we are not alone, we have to talk to the outside world out of the onco community. So there are policymakers which decide on how healthcare systems look like in Europe, and they are very different. So we want to talk to policymakers. We need to talk to taxpayers because we have to explain how we use their money for cancer research. All these things are very important, and that's our approach in this onco policy meeting, which is an annual event, and in the ESMO conferences, it's always taking place in the conference. And there we have for this year the topic of health inequalities, which are very obvious here and which we want to tackle. And we want to give our professional advice, and the patients want to give the patient side, and that we want to bring together with the policymakers on how we can do it better. And a very specific example is clinical trials are very, very important in cancer research, obviously. There is in Europe, there's legislation in a clinical trials directive that is in place for now almost 10 years. It has been reviewed. There are shortcomings of this legislation. And so we want to discuss in one of the sessions how can we improve, what is the need, what is the current experience with what we have. So I think these things are a very important feature in a scientific cancer conference.
Are there challenges based on the fact that amongst these European countries that healthcare practices and policies vary? You know, France, the UK, Germany, wherever. What are some of those challenges when you bring these countries together when healthcare delivery may be different in each of these countries?
Yeah, there are of course problems with that. Then in Europe we have some countries where still the healthcare system has to expand on even basic infrastructure sometimes. And for these healthcare systems, that's the next step. If you do not have enough operating rooms or not enough skilled surgeons to do cancer surgery, then it's something which you really have to set in place. Or if you do not have enough linear accelerators to give radiotherapy, then that's very important. So for some countries, those are the things which really need to be approached now. For other countries which have these situations in place, there may be some other questions in the moment more burning than this. And this has to be brought together in a conference, so we always try also to get an understanding on what the status is in the different parts of Europe and how we best can improve the treatment then for all cancer patients.
I would think that the multidisciplinary approach now is more vital than ever.
Yeah, I said that yesterday in my opening speech of the conference. Multidisciplinarity is necessary in research as in patient care. And it doesn't make any sense. Research is for future patients. It doesn't make any sense to do a bit of research in a very specific field, which in the end cannot be integrated into the multidisciplinary scenario in the best treatment approaches we do today. So also there you need interactions between clinicians and scientists, and you need interactions between the different disciplines in the medical field so that you really can get the best research results which improve outcome on a short term, as fast as possible at least, and also substantially. And I think therefore you have to think how you can do it together as a team.
And as you are current president of ECCO, the goals that you are still hoping to implement during the time that you are president?
Well, actually, the multidisciplinary aspect also to promote that very strongly in the meeting was the top note on my agenda. What we still want to achieve till end of the year when my term is over is that we want to set some fundamental rules and ideas on inclusivity in the multidisciplinary scenario. That's a discussion on the board which has been ongoing for 2 years, and we will finish that discussion in November, and I think that's a very important step.
I am very impressed with the real effort that the meeting has put forth for patients, for the advocates, and that the advocates are really here on a level playing field. They are equally important, and I've been very impressed by the attention that's been paid to the advocate community.
Yes, thank you very much, but we intended that, and I'm very happy that you agree with what we achieved here.
I do have a final question, and that is really, I'm going to call it the emerging role of the proactive patient. This is a very dynamic shift in the way it was a decade ago. And I'm also seeing how European physicians across all the disciplines are embracing with a lot more comfort this proactive patient. Maybe you could talk about that a little bit, because it is a paradigm shift for Europe, with the patient being much more educated and involved in their treatments.
In my opinion, that's a very, very positive development. So in the end, we are talking about the best care for a patient, the best quality of a patient, and that needs to be judged also by patient, what it means. By individual patients, but also by patient groups as such, which have a profound discussion on these things and set priorities which the professionals, not only doctors, also nurses, have to take into consideration in their daily work. So why not talk with patient advocates and on how to create a meeting? Why not talk about what are the most burning questions for research? I think this all is timely to do, and I think it will help the whole field to progress.
Well, I congratulate you on what appears to be a great meeting. There's enthusiasm and a lot of warmth out there. People are smiling. And I've had a chance to speak to many of the advocates here, and they're excited because of what you've enabled them to have here, and you've given them and us a voice, because I'm an advocate too.
Thank you very much.
Thank you, Professor Dr. Michael Baumann, President of ECCO and President of this multidisciplinary meeting. I hope I will see you again in 2 years.
Thanks.